Hello everyone and welcome back to Urban Legends. We're now in what's called, I guess, the medical part of Urban Legends, so I'm not sure what it's going to actually be all about until we get into it. The first episode is called Dead Banging. In 2013, overzealous heavy metal fans were warned by authorities of the dangers of vigorously headbanging, the custom of shaking one's head to the rhythm of Motorhead or Metallica, because their practice had been linked to serious brain injuries. It was reported that a German fan required treatment after banging his head too vigorously at a Motorhead show. The middle-aged heavy metal enthusiast enjoyed a night of skull shaking but suffered from increasingly painful headaches for a month afterwards, leading to a scan which revealed bleeding in the brain that required immediate surgery. The rock fan was lucky to survive, but medical experts were surprised to discover that brain hemorrhages caused by headbanging had happened on more than one occasion in medical history, and some were fatal. It was rumoured that an AC/DC fan from London succumbed to the condition during a performance of the song Brain Shake at Wembley Arena. The next is Fireworks. A blind young man named Paulo from South America was visiting his cousins in Rio de Janeiro for New Year's Eve and enjoying a street party as the coming year was welcomed across the city. Once the clock struck midnight, fireworks shot across the sky. As he smelled the familiar sulphur and heard the sounds of the explosions, he felt a stabbing pain in the side of his head and saw a flash of colours before he blacked out. When the boy came round in hospital, he got two large surprises. He could see, and he had sneezed out a small shiny metal object covered in blood. It was a bullet. To say it was a mystery would be an understatement, but the police eventually cracked the puzzle. As was the New Year custom in the area, the local ranchers and cowboys fired their rifles into the sky at midnight. After imbibing a tad too much local liquor, and one stray round had returned to earth and entered Paolo's head through the top of his skull. The bullet passed behind his eyes, hit his nasal bone, and lodged itself in his nostril, grazing a nerve that meant he could now see, and all without causing any lasting damage. Wow. The next is gas attack. Authorities blamed an unusual diet and lack of ventilation for the death of a morbidly obese man found dead at his home in Florida. Neighbours hadn't seen or heard the man for several days and alerted the police. Knowing he was unwell, doctors first assumed that he had died as a result of his bulk, but the first paramedics on the scene noted that the room was full of foul odour that left them unable to breathe. They had to be hospitalised after collapsing due to the smell. The man had produced so much methane gas from his own flatulence in his small, unventilated room that he had suffocated in his sleep. A post-mortem revealed dangerous levels of gas still in his system and large amounts of beans and Brussels sprouts, his favourite foods, in his stomach. A food goes to your head. People always say that you should immerse yourself in the local culture when you visit a new country, and at the very least, you should try the food. Sometimes, however, it's right to be wary about what you're eating on your trips in exotic destinations. An American woman who had recently returned from South America was ill for weeks. She rightly assumed that she had picked up something nasty when she was abroad, but she didn't know what. Then she began to suffer violent seizures. When doctors scanned her brain, they found a lesion of some sort, which had to be investigated to establish whether it was cancerous. She underwent a 6-hour procedure that had to be performed while she was awake, and it was such a sensitive area of the brain. Her doctors were shocked to discover that a parasite tapeworm had burrowed inside her brain tissue, causing damage and inflammation. If such swellings become too big or in the wrong place, they can cause the blood flow to the brain to be cut off. They were able to remove the worm from the woman's head, and she made a full recovery. Doctors believe that the parasite entered her body after she ate a pork taco on holiday. The tapeworm spreads as a result of poor hygiene when preparing food, thus allowing its eggs to enter the human gut and develop into a worm, which then travels through the bloodstream and, if you're particularly unlucky, burrows itself into the brain. The next story is a donation. A German man was visiting Thailand for a business conference and stayed in a plush hotel in Bangkok with his colleagues. On the last night of his trip, he was winding down with other attendees and sharing a few drinks in the hotel bar. He had asked the barman if he had any tips for places to go for a good night out in the city, but was told that it wasn't safe at that time of year for foreigners. He wasn't convinced, but a particularly nervous workmate persuaded him to stay in the hotel bar, especially as the bartender was offering drinks on the house. The cocktail started flowing, and soon he was feeling a little tipsier than normal, but he put that down to being stressed out and tired after the business meetings. His nervous workmate bid him good night and turned in, reminding him that he had a flight to catch in the morning. However, by then an attractive local girl had started asking the man questions and buying him more drinks, so he barely noticed the advice. The last thing he remembered of the night was telling a joke about him suffering liver after his colleagues had disappeared upstairs. The first thing he felt the next morning was excruciating pain, not in his head, but in his back. He was shivering in a bath full of ice, coloured red from blood. His own blood. He discovered to his horror, as he noticed a tube protruding from his back. Around his neck was a note written in German: "Call the embassy, or you die," with the embassy number. There was a phone within reach, and he dialed it with shaking hands. He told the woman on the other line where he was and described his situation. She asked calmly whether there was a tube in his back, and if this was a regular occurrence. When he confirmed there was, she told him not to move under any circumstances and explained that paramedics were on their way. Both of his kidneys had been removed. Now that's a very old urban legend, isn't it? The kidney removal one. A funeral fire. The work of an undertaker is generally pretty straightforward, and their clients are usually not ones to cause trouble, but sometimes the human body can throw up surprises. When it comes to cremations, the larger the person, the longer and hotter the fire will burn. When a 60-stone man, was cremated in Virginia, USA, his bulk was too much for even the specialist equipment to handle. As the temperature rose, his body fat melted and human grease leaked out of the oven, causing the building to become engulfed in flames. Firefighters had to be called to oversee the cremation to the end. Similarly, a particularly large Austrian woman also caused a building fire when she was being cremated, sparking calls for a weight limit for health and safety reasons. Switzerland, on the other hand, always precise, ensures that overweight deceased persons are handled by a specialist facility built, well, to withstand the extra heat needed. Jeez. Science is dangerous. One day in July 1978, a Russian scientist studying for a PhD at the Institute for High Energy Physics near Moscow was performing maintenance on a particle accelerator. The machine was the largest in the Soviet Union, using electromagnetic fields to fire particles through a giant tube at speeds close to the speed of light. Something went wrong with the safety procedure, and a beam of charged particles shot right through the scientist's head, giving him a dose of radiation thousands of times higher than a human should be able to survive. Despite seeing a flash brighter than 1,000 suns, he felt no pain. The left-hand side of his head, where protons travelling at nearly the speed of light had entered, had swelled until he could not be recognised. The burned skin eventually peeled away, revealing the path of burned tissue and bone that the particles had seared through his head, as they entered through the nostril and exited through the back of his skull. Although he had survived the event, doctors expected that he would soon succumb to the high levels of radiation and suffer a lingering death. However, he didn't die. He made an almost complete recovery with only hearing problems and some facial paralysis, to show for his ordeal. His brain worked normally, although he did tire a little quicker, and he was able to complete his PhD studies and start a family. The narrow beam of protons had passed through his brain without harming the vital tissue. A similar technology is used today in radiotherapy to destroy cancer cells without harming healthy tissue. The next is It's a Boy. Scientists have discovered that a 3,000-year-old pregnancy test used by the ancient Egypts was remarkably accurate. Expectant mothers would pee on pieces of barley and wheat. If the barley grain sprouted, they were pregnant with a boy, whereas if the wheat sprouted, then it was a girl. Recent tests have found that it was probably 70% accurate. Techniques hadn't progressed much by the 1920s, but scientists discovered that they could tell whether a woman was pregnant by the presence of a chemical produced by the placenta. The only way to test for this substance was to inject the patient's urines into the veins of animals, usually mice. Then the ovaries of the rodents would be removed and tested for the chemical. Of course, the mice died. Thankfully, it was discovered that there was another option. The prospective mother would give a urine sample, which was then injected into an unsuspecting African clawed frog. If the animal produced eggs within 1 day, the woman was pregnant. The benefit of this test was that they didn't have to kill the frog to get the result, as one creature could be tested repeatedly. The test was widely used until the 1960s, when new techniques that didn't involve amphibians were developed. Wowzers. I actually didn't know that. That's crazy. The Man with Two Faces. A disturbing video once made the rounds on the internet. In the clip, doctors are treating a hideously deformed man who has what appears to be a second face on the back of his head, complete with a mouth which opened in tandem with the other, tongue, teeth, and crude facial features. It was said that the man was Chang Tzu-ping, who lived as a hermit in a remote Chinese village, too terrified to show his face to the world. The local children would jeer and throw rocks when he left the house. In the 1970s, he was discovered by a troop of American soldiers who rescued him from his tormentors and took him back to the States, where his second face was removed in a 12-hour operation as part of a diplomatic deal. It's speculated that his case may have been an example of fetus infantum, an extremely rare condition occurring in multiple pregnancies when one embryo becomes stuck inside the other and grows inside its twin. The next is self-surgery. In 1961, the only doctor at a remote Russian Antarctic research station fell ill with what he suspected was appendicitis. He hoped it would get better on its own, as the nearest Russian base was 1,000 miles away, and a blizzard had been raging for days, preventing any possible rescue by aircraft. When the pain became excruciating and he developed a fever, he knew he had only one option: remove his own appendix before it burst and killed him. The 27-year-old enlisted a driver and a scientist as ad hoc theatre nurses, and propped himself up in bed. He numbed the affected area with a local anaesthetic and set to work, slicing into his own stomach and removing the inflamed organ. While the assistants held up a mirror so he could see his handiwork, despite his scalpel slipping and cutting into part of his gut, he completed the operation in 2 hours and was back on duty within a couple of weeks, becoming a hero of the Soviet Union. Geesh. I've had appendicitis and I had my appendix out, so it's really painful. I can understand why it resulted in removing it himself. It is excruciating. The next is do it yourself. One American surgeon working in the early 20th century was not what you would consider your typical physician. He tattooed newborn babies, not for decoration, but so that they would not get mixed up with other babies in the hospital. The mother would be marked with an identical tattoo so that she could forever identify her child. He also took to putting his signature on the patients on which he had successfully operated, leaving his initials tattooed on their body. He was most renowned for performing surgeries on himself, though. In 1919, after one of his fingers became infected, Rather than call on the services of one of his colleagues, he set to work amputating his digit himself. However, this was child's play compared to his future experiments. A couple of years later, when he came down with appendicitis, and you can see where this is going, he decided to test whether he could remove his own appendix himself, blazing the path that a Soviet doctor later followed, using only a local anaesthetic. The surgeon who had been planning to do the job was understandably shocked, but as the patient was the chief surgeon of the hospital and his boss, there wasn't much he could do about it. The eccentric physician wasted no time in injecting drugs into his abdomen and slicing open his own stomach, removing the appendix with the help of mirrors in less than half an hour. He was back operating on other people within 2 weeks. The next time he required a surgical procedure, this time for a hernia at the age of 72, he picked up the scalpel once again, although this tricky procedure required him to eat extremely close to the cut. Sorry, I meant to say cut. It says eat. That's silly. That's a mistake. It required him to cut extremely close to the femoral artery. He laughed and joked with the nurses as he completed it in 2 hours. As he tired towards the end of his operation, he finally allowed a colleague to stitch him back up. Wow. So those are all the ones that come under the medical urban legends. I'm not sure there's so much urban legends myself. Did they really happen? I think they did. They're out there for people to read. So, I mean, they could be urban legends, I suppose. Stories just passed from generations. I mean, you decide, guys. What do you think? Many blessings.